Attention, there has been a recent public service announcement regarding the chemical compound acetylsalicylic acid.
More commonly known as the over-the-counter drug aspirin. Aspirin is a household drug that is used to reduce fever and relieve mild to moderate pain from conditions such as muscle aches, toothaches, common cold, and headaches.
Aspirin works to avoid your blood cells from clumping together. It is an over-the-counter drug, 50 milligrams to 6,000 milligrams, available to all who require relief from such symptoms, most commonly known as Bayer aspirin.
Despite its extremely useful remedial effects, aspirin carries extremely negative properties if abused or even just used on a daily basis.
Most side effects are unknown to the majority of its consumers of this medicine.
The most minor side effects consist of the appearance of rashes, upset stomach, heartburn, and drowsiness. However, there are many more severe outcomes to using aspirin.
Heart disease, risk of bleeding in the heart, brain and/or stomach, and gastritis, which is the inflammation of the stomach lining. The cause of having so many severely dangerous health risks is the purchase of over-the-counter medicines like ibuprofen, Tylenol, and Advil or Aleve.
Though there are numerous side effects, aspirin does still produce a reliable pain reliever, fever reducer, and fighting the common cold,
which results in aspirin's well-known popularity and its continuous purchase since the creation in the 1890s by Felix Hoffmann Bayer.
The drug must be administered in dosages recommended by doctors or following the age restrictions found on the medicine bottles. The idea that higher dosages increases the effectiveness of the drug is a fallacy.
Low-dose aspirin is often just as effective, if not more, than standard 325 milligram. It remains safer and is often recommended much more than the standard. The 325 milligram dose should be used in severe cases such as heart attack, but a person taking an aspirin as a preventative measure should stick to a dosage closer to 85 milligrams.
The consumption of more than the required amount can result in a more severe side effects.
In regards to daily aspirin users who intend to stop, it is highly advisable that one takes up the decision with a doctor before stopping.
Stopping a daily dosage of aspirin without a doctor's assistance could result in a higher risk of a heart attack. If you have had a heart attack or a stent placed in one or more of your heart arteries, stop daily aspirin therapy can lead to a life-threatening heart attack.
Suddenly stopping daily aspirin therapy could have a rebound effect that may trigger a blood clot. Surgical procedures will require one to report their usage of aspirin due to the fact that it may cause excessive bleeding and severe damage.
For adults who drink alcohol, the blood thinning caused by aspirin will cause stomach issues for excessive use.
It is recommended that adults keep alcohol consumption to a maximum of 1 drink per day.
If you're already taking an anticoagulant such as warfarin, Axivan, Daguerreotyrum, Rivaroxaban for another condition, combining it with aspirin may greatly increase the risk of major bleeding complications. These may be some conditions where combining the two could be done safely and effectively, but it is highly recommended that one see their doctor.
If you think you are having a heart attack, the most important thing for you to do is call 911 or emergency medical services. Don't delay calling for any help. Aspirin alone won't save your life if you're having a heart attack. Under the care of an emergency operator, they may ask you to chew on a specific dosage of aspirin. Beforehand, they will ask of any previous medical health conditions that may disqualify you from taking the medication. This is done to prevent further complications during the heart attack. Thank you for your time and attention. Remember, aspirin isn't created to be a narcotic. It's made to be handled in a professional and mature manner.